congratulations. Congratulations on your pregnancy. As you take care of yourself and your growing baby, your mouth deserves attention as well. Today we'll talk about periodontal disease, also known as gum disease, and why it matters during pregnancy. Let's dive in. Alright, so periodontal disease is defined as an infection and inflammation that affects the gums and the bone that supports your teeth. The earliest stage is called gingivitis, and that's when your gums look red, swollen, and bleed easily when brushing. If gingivitis isn't treated, it could progress to periodontitis, which is a more serious stage that can damage the bone and tissues holding your teeth in place. So you may ask, what causes, gingivitis and periodontitis? Well, the main cause of this is the bacterial plaque that's in our mouth, and it communicates throughout the day. So it looks like a sticky film that builds up on your teeth every day. During pregnancy, your body hormone levels are imbalanced, where estrogen and progesterone can make your gums more sensitive and prone to inflammation. This means even a small amount of plaque can cause your gums to react strongly. Other factors include poor oral hygiene, smoking, diabetes, and stress. So you may ask, what's the difference between gingivitis and periodontitis? Well, gingivitis is reversible. With great oral hygiene at home, such as brushing and flossing and keeping up with your dental cleanings, could help that reverse back to a healthy mouth. But with periodontitis, it causes more permanent damage and it's not reversible. So that means that it leads to gum recession, bone loss, and you could eventually lose your teeth. But the great news is that early detection and care can stop it from progressing. So think about gingivitis like a small fire you can easily put out. But if you ignore it, it spreads and damages the foundation, which is also known what periodontitis does in your mouth. It's being destructive in your gums. So there's certain types of bacteria that can be more harmful than others. One thing you could do is ask your dentist about saliva tests to see what kinds of bacteria are in your mouth. Just remember that having bacteria doesn't mean you automatically get gum disease. It simply gives us a helpful information about your personal risk so we can take the right steps to keep your gums healthy. So when the gums are infected, the bacteria and inflammation don't just stay in your mouth, they can travel through your bloodstreams and may affect your pregnancy. Studies have linked gum disease with early labor, low birth weight, and other complications. So keeping your gums healthy protects both you and your baby. Healthy gums aren't just important for you, they can also benefit for your baby. Most pregnant women want to do everything possible to give their baby the healthiest start in life. That's why your oral health during pregnancy is so important. When you keep your gums healthy, you're not only protecting yourself, but you're also helping set your baby up for a lifetime of health from delivery all the way. Did you know that 1 out of 4 children develop tooth decay in their baby teeth? Well, many people think that baby teeth are not that important and they will eventually fall out. But baby teeth actually help guide speech, nutrition, and the development of the adult teeth. And here's something many families don't realize, that bacteria that causes tooth decay and gum disease are often shared between mothers and their babies, especially in the first year of life. So when you take care of your mouth now, and you're reducing the amount of harmful bacteria your baby will be exposed to later. There are many ways oral bacteria can be passed to your baby, such as sharing drinks, using the same toothpaste, licking a pacifier or bottle to clean it, kissing, or even sharing food. These everyday habits can transfer cavity-causing bacteria without us realizing it. Alright, so now by keeping your gums healthy during pregnancy, you're creating a cleaner, healthier oral environment for both you and your growing baby. It's one of the simplest and most powerful ways to support your child's long-term health. Okay, so now that we understand what gingivitis and periodontitis is, let's talk about what we could do about it. The good news is that with the right care both at home and with your dental team, we can control your gum disease and protect your smile through your pregnancy. Healthy gums start with what you do every day. Your home care routine makes the biggest difference. Let's talk about some home care routines that you can do at home. So the first one is brushing twice a day with a soft bristle toothbrush and fluoride toothpaste. Angle the toothbrush towards the gum line at a 45-degree angulation and make small, gentle vibrational circles, especially if your gums feel very tender. And don't forget to brush your tongue. Start at the very top and gently pull the brush downwards 3 to 4 times. Flossing at least once daily could really help you remove plaque and food debris that gets stuck in between your teeth. If regular floss doesn't help or it feels tricky, you could try a floss holder or a water pick or even interdental brushes. Also, taking your prenatal vitamins and drinking at least 2 liters of water daily can keep you have a healthier smile and a healthier pregnancy. Vitamins such as calcium, vitamin C, and folate support gum and bone health. And the most important thing, do not skip your dental visits. Preventative cleanings are safe and highly recommended during pregnancy, ideally in the 2nd trimester. Local anesthetic is safe during pregnancy, especially when using lidocaine and considering your overall health status. We will request a clearance much plaque buildup you have, which is the root cause of gum inflammation. At the dental office, your hygienist and dentist work together to treat and control periodontal disease. According to the American Pregnancy Association guidelines, American Dental Association, which is the ADA, and the American College of OBGYN states that the dental care, including x-rays and necessary procedures, are safe during pregnancy. Professional care happens in two different procedures, which is the first one is called non-surgical periodontal therapy, also known as a deep cleaning, and the second, which is a surgical periodontal therapy, which is known as advanced gum treatment. So non-surgical periodontal therapy, it includes scaling and root planing, also known as a deep cleaning that removes plaque and calculus under the gums. This is typically the first and the most common procedures we begin to treat gum disease. You'll also receive oral hygiene instructions, local delivery antimicrobials if needed, and a reevaluation appointment to see how your gums are responding after the treatment. Most pregnant patients can safely receive this therapy to help reduce inflammation and bleeding. Surgical or advanced therapy means when deep pockets remain after non-surgical therapy with areas that are difficult to clean. A periodontist may perform surgical therapy to access and clean the roots more effectively or repair lost tissue. There are a variety of ways to treat gum disease surgically, and your dentist will refer you to a specialist if it's needed. However, surgical therapy is usually postponed until after delivery unless urgently needed. Your providers will coordinate care with your OBGYN to ensure all the dental procedures are safe for you and your baby. It is important to understand that periodontal disease can be controlled but not always completely eliminated. Even after treatment, bacteria can return if plaque builds up again. With daily brushing, flossing, and regular maintenance visits, you can keep your gum disease under control. Many expectant moms feel guilty when they notice bleeding gums or inflammation and wonder, is it my fault? The truth is, no, it's not your fault. Periodontal disease is complex and influenced by many different factors, like I just explained earlier. Some you can just control it, and some you just can't. First of all, genetic plays a huge role. Some people naturally have a stronger inflammatory response or a higher tendency for gum problems. If your parents or siblings have gum disease, you may be more susceptible, even with great oral hygiene care. That's why regular checkups are so important. Your lifestyle also affects your gum health. Tobacco or illicit drugs that are used in many different ways can affect your growing baby, delay healing, and worsen inflammation. Nutritional also matters, so eating plenty of fruits, vegetables, and calcium, vitamin C, and folate supports health gums and tissues. Also, systemic conditions such as diabetes, gestational diabetes, or stress can make your gums more reactive to plaque. Also, sometimes tooth-related factors such as old fillings with rough edges, crowded teeth, open contacts that trap food, or heavy bite forces can irritate the gums, and it can trap a lot of plaque as well. These don't cause gum disease, but it could aggravate the disease a little bit more faster. So remember, periodontal disease isn't caused by just one thing. It's a multifactorial, meaning many factors work together. Pregnancy hormones can heighten your gums response, but with professional care and constant home care, you can stay healthy and in control. It's not about blame, it's about balance, awareness, and teamwork between you and your dental care team. After your gums have been treated and started to feel better, you might wonder, am I all done here? The answer is, well, treatment is only the beginning. Periodontal disease can be controlled, but it needs regular care to stay that way. That's why recare and maintenance supports are so important. Even after deep cleaning, bacteria naturally starts to come back within a few weeks. These bacteria recolonize below the gums and can restart inflammation if it's not removed. Maintenance visits help your hygienist clean areas that are hard to reach at home and monitor any early signs of relapse before they turn serious. For most patients with gum disease, professional maintenance is recommended every 3 to 4 months, not just twice a year. It can also vary depending on the plaque buildup. This schedule keeps bacterial levels low, supporting healing, and allows to track improvements. During pregnancy, staying on schedule is especially helpful because your gums can be more reactive to plaque. Making your gums health a priority pays off not just now, but for years to come. Regular maintenance helps prevent tooth loss, keeps your breath fresh, and contributes to overall wellness. As a mom, caring for your oral health sets out a positive example for your child. Remember, a healthy mouth supports a healthy body and a healthy pregnancy. By partnering with your dental hygienist and staying on top of your home care, you're protecting your smile and you're giving your baby the best start possible. Healthy gums, healthy pregnancy, and a healthy you.